So in the city, we've had programs in the past. You know, I think AtlantiCare has a long-standing history of services to this degree in Atlantic City. We recently brought it back, like we said, in December. So we've done it intermittently through the years. I think it's been quite a while since we've had family planning from AtlantiCare in Atlantic City. We recognize that there is absolutely value to family planning services. There's definitely need. We see it in our offices. Dr. Pieri does family planning all the time. This is a passion she has. We recognize that there is a direct correlation to the impact that family planning services has on the reduction of maternal and infant mortality.
If a patient of mine tests positive for sexually transmitted disease, for example, there was sometimes a gap in getting care for their partner, right. Which was becoming a problem. And so it's nice that we can offer those services to men as well. Yeah. The internet, fortunately or unfortunately, provides a lot of information, and not all of it is correct. And so at every level, teens, adults, people who are educated, people have misperceptions about both STDs, contraception, family planning, fertility, and so this is a real opportunity that we can take our time with patients and educate them about their bodies. We're not just here to prevent pregnancy. We provide fertility counseling, which a lot of times is basic education about reproduction, about their menstrual cycle, about, egg and sperm meeting up in a certain location. There's a lot of education that goes behind this, which is fantastic.
It's almost like taking advantage of an opportunity that didn't exist, right? I mean, I think the need is directly proportional to the opportunity that's there. When we didn't have family planning services, obviously people couldn't take advantage of them. But I do find that we do see quite a bit of walk-ins, people just learning about it. We see appointments, we're full every Wednesday, and I'm sure we will fill the time 5 days a week.
How many physicians do you have on the Wednesdays?
Just Dr. Pieri. We have one provider at a time, so each day it's one provider. And we have other providers, all on APG, OBGYN staff, certified midwives, and also other physicians that family planning specifically has to the reduction of maternal mortality and infant mortality. I think it allows for the opportunity to properly plan and space children so that, the incidence of those types of things go down. I think that, the confidentiality of it and the access, the access is, really there because it's not dependent on if you have insurance or that you're financially able to afford the service. Everybody is served. Nobody is turned away. And I think, these are the kinds of services that, cities, particularly populated cities, definitely benefit from.
I agree. I think patients who want to achieve pregnancy, us helping them, optimizing their health and achieving that at a time in their life when it's appropriate for them is important. Us helping people who do not want to be pregnant not become pregnant is important for them. Sexually transmitted diseases, some of them are on the rise, and so it's important that we test people, we treat people. They can snowball into other issues. So, for example, syphilis is on the rise. So, therefore, congenital syphilis is on the rise. That is when they contract syphilis when they're pregnant. And so, as a place that offers both treatment and testing for STDs, that's important. That's important for preventing problems with, congenital abnormalities in our children. And so we have our hands in a lot of different things to try and help maximize the health of people who are trying to get pregnant and help the people who don't want to be pregnant don't get pregnant. And then when you bring in other things like educating women about their bodies, you're touching on other issues. You're empowering women to understand their bodies and to feel comfortable with their bodies and feel comfortable with their relationships. And we do a lot of things here that we just don't have the opportunity to do in some of our other offices.
Right.